Hello, this is Dr. Do again. This video is on alphabetic list problems, still on letter F. Today I'm going to talk about a special disease belong to psychological or psychiatric category. It's called functional somatic disease. First of all, is any emergency situation associated with this functional somatic disease? Probably not, because it is a chronic again, and it's a psychological and without any organic or really pathological disease, but it is a disease. So before I talk about this functional somatic disorder, let's talk about what is a somatic disorder, somatic diseases. First of all, we need to know somatic diseases are the disease. It's not like something created or malingering or factitious disease, because those are the diseases that manipulating, pretending, treat the symptoms for the secondary gain or for the attentions or to satisfy the psychological need. But this somatic disease, it is a disease. It's a truly feeling. For example, the pain is there. The pain is there, just cannot find any pathological or organic causes. So this is the somatic disorders. It is psychological. It is a disease. We have to recognize that it's not like a malignant or factitious disease. So what kind of somatic disorders? There are a variety of it. For example, multiple discomfort, multiple pains either from chest pain, but it's not cardiac cause, headache without any categorized diagnosis, or joint pain without any organic or inflammatory changes under the X-ray or under the serology study, which means the antibody test or the X-ray. They are all normal, but the pain is there. So this belongs to the somatic disorders, which the definition is psychological disease transformed into the somatic presentation or symptoms. So this is a group of diseases, multiple symptoms. So this is including variety, like probably abdominal pain. Like I said, we had this kind of patient, just abdominal pain, and without any causes, and without any X-ray was normal, and serology or the blood test was normal, and no causes. But eventually, because under the request of the patient, want to have a surgery because just the pain is there, I couldn't find the causes. So eventually, the surgeon did open up, and then turn out it's a psychological. But there's no obstruction. The bowel movement was normal, totally normal intestines, but filled with airs, and just the disease is there. So that's why the pain is there. So this kind of patient has to find a way to psychological or use a psychiatric medication to manage them. So this is a somatic disorder. What is the functional somatic disorder? It's one symptom, one presentation in a variety of range, but only one. So this is a functional somatic disorder. For example, I talk about the somatic disorders could be at the same time feel generalized pain, chest pain, joint pain, headache, abdominal pain, all over places, just the pain everywhere. So this is the somatic disease. Organic somatic disorder is just one symptom. For example, either headaches or without any diagnosis in any category. For example, the migraine or the tension headache, nothing. And CAT scan, X-ray, variety of tests, all is normal, but just the headache. It doesn't meet any categories. Or the chest pain, which is non-cardiac, non-costal, non-muscular, just the pain, the chest pain. It happens. So individual or abdominal pain, just like I said, the patient I had before, just had abdominal pain. Just the pain is there, bothered the patient, so the patient keep pursuing, keep seeing physicians from one to another, multiple medical experience, but still cannot solve the problem of the pain. So this is the functional somatic disorder, just one presentation, only one symptoms, instead of the somatic diseases, which are multiple pain, multiple presentations. So how to diagnose this kind of patient? Usually they are associated with the psychological causes or psychiatric disease or depression, anxiety, or for example the fibromyalgia or a similar situation, and they have prominent psychological disorders associated with this, or this depressed or anxiety, like I said, or any other insomnia cause this kind of functional somatic disease disorder. So how to diagnose? Basically empiric from the experience, because these patients are young, usually occur in young patients, could be also older, young and old, both, and do all the lab tests which is necessary to exclude, especially the thyroid. Has to do the thyroid test to make sure there's no abnormal thyroid function, hypothyroidism, for example, because hypothyroidism sometimes can be associated with this kind of pain. The pain was not quite clear, like a vague, just here or there, feel the pain uncomfortable, so have to be excluded the thyroid disease or the inflammatory or immune disease, or for example the serology test for the rheumatoid arthritis, which is negative, lupus was negative, all the other arthritis has to be excluded to make sure it's not belong to any of those. And then need to so the after the diagnosis, from the exclusion, then treat. It's really the pain medication. Sometimes it's not very effective in this group of people. On the other hand, psychological or anti-inflammatory medication might have some effect, and also the sleeping medication can also help. So this is a group of disease. I think it's probably the functional illness, one of it. This is called a functional somatic disorder. It's just because it is belong to a somatic disorder. It has a psychological or psychiatric associate problem, somatic transformation. It is a disease, so then just the one instead of multiple. If somatic disorders is multiple, but this is a functional somatic disease, just one individual, one symptom. So in terms of treatment, I think it's just has to be associated with the decreased stress level, lifestyle modification, improved sleeping, and also doing relaxation. So these are the treatment for this functional somatic disease. So I hope if you are either young or old, I hope this video is helpful. If you have this kind of subtle, vague pain, not sure what's going on, get it checked and get it diagnosed to exclude, and then find the cause and then treat it accordingly. So I'm going to stop here. Thank you for watching. I will see you next time.